is to actually use a prophylactic mouthwash prophylactically.
Right.
And starting it before those mouth sores develop.
And not stopping it at 2 weeks because you didn't get mouth sores and you don't think you need it.
Good point, yes. Let's talk about the primary endpoint. Can you walk us through the PFS results for, I guess, both trials? Because, again, keeping in mind that the populations are slightly different, as you pointed out, I think it's interesting that we saw fairly similar performance of the control arm with some small differences. Let's start with Datopotamab Deruxtecan. What should we keep in mind in terms of the AEs that were reported in TROPION-Breast02?
Yeah, absolutely. So, I think the side effect that most people talk about when we're talking about Datopotamab Deruxtecan is stomatitis, so mucosal inflammation. And what makes it tough with some of these drugs is that a prophylactic steroid mouthwash was recommended as part of these protocols, but there are certain places that, don't have access to it. In fact, sometimes pharmacy to pharmacy can be a little bit variable even within a city, but there certainly are areas that prophylactic mouthwash is hard to get. So we don't have great data on exactly how many people actually received it in a prophylactic fashion. And so at least for me, practicing in the United States, where I'm going to routinely use that, it makes it a little bit tough to fully interpret the stomatitis rates. But I think, stomatitis is one we've really got to watch out for 2 reasons. One, as opposed to neutropenia, patients feel that it bothers them, and so it's a quality of life issue. And 2, in my experience, if patients really get stomatitis, it can be tough to get rid of. And so I think that prophylactic steroid mouthwash is really important. And we see this with a few other drugs as well.
Absolutely. I couldn't agree more. I think in my experience, the key has really been, and you alluded to this, is to actually use a prophylactic mouthwash prophylactically.
Right.
And starting it before those mouth sores develop.
And not stopping it at 2 weeks because you didn't get mouth sores and you don't think you need it.
Good point, yes. Yes. Now, it is an ask of our patients, of course, and let's talk about ocular toxicity. This was early grade, but can you walk us through the prophylaxis for ocular toxicity and the kinds of things that were reported with Datopotamab Deruxtecan?
Yeah, with the ocular toxicity, mainly it was dry eyes. And so I think it's really important when we talk about ADCs to not kind of lump everything in a class. We do have ADCs that have really problematic eye toxicity, corneal toxicity, et cetera. This really was predominantly dry eye. We've kind of done a variety of things. I find with my experience with Datopotamab Deruxtecan, it doesn't tend to be that big of a problem, and really kind of people are maybe needing re-wetting drops, et cetera, lubricating drops, but less worrisome than some of the other ADCs.
I think that's such an important point that you raise, because we have seen other ADCs, some of which are approved for the treatment of other cancers, that, as you said, have more invasive ocular toxicity, but also in my experience, this has really been surface events that are manageable with eye drops and so forth, and I think it's helpful to have an ophthalmologist or optometrist that you could potentially reach out to, but maybe not necessary, although we know that at least annual visits or checkups can be helpful in general. Any other adverse effects that stuck out to you or that we should think about with Datopotamab Deruxtecan?
I mean, I don't think anything that really stood out, but again, it's an antibody drug conjugate. It does have a cytotoxic payload. You are going to want to use some, antiemetics. We certainly can see nausea, that type of thing, but no big surprises.
Yeah, I agree. I mean, I think in the triple negative setting especially, we're a little more tolerant, unfortunately, to adverse effects because of the limited treatment options. But when a trial like TROPION-Breast02 comes along, it's really encouraging to see a manageable treatment being efficacious like this.